Today we are going to deal with Chapter 18, Health Organizations. Health is one of the primary concerns of all the governments of the world. Every government wants that at national level or at global level the safety should be there and all the people in the given country should remain healthy. So this chapter also aims at familiarizing the students with two main organizations, that is Red Cross and India is a very big country. It has varied geographical and climatic conditions. So its population is also divided into 5 broad categories. First is big cities. Big cities are those in which multi-storied buildings are there, too many vehicles are present, they are heavily burdened with water supply and sewage systems. Then there are small towns. Small towns are not so crowded. Then villages are there. Villages have small populations. They are mainly agricultural based, dairy products, poultry farming, cottage industries, they are present in the villages. Then remote areas are there where tribal people are living. They are mostly dependent upon forests and forest products. Their proper drinking water and medical facilities are lacking. Then we are having slum dwelling areas. Slum dwelling areas where jhuggi-jhopdis are present. And they are lying on the outskirts of big cities. Unhealthy, unhygienic conditions are prevailing in these areas. The health problems in each kind of habitations are different. We may generalize them firstly on the basis of food and waterborne diseases. These are mainly diarrhea, gastroenteritis, typhoid, dysentery. They are very common in areas which are deficient in proper water supply. At many places, water from hand pumps and other sources is contaminated. At certain places, harmful mineral contents are present in the water. Untreated sewage or effluents. Effluents means the waste from the industries that is poured into the rivers and other water bodies which harm the people living alongside. Then second kind is insect and airborne diseases. They are mainly occur in those people which are uneducated and are village folk, not conscious about the flies. And usually the flies contaminate their foodstuffs when they are lying exposed. Lack of general cleanliness is there, leading to breeding of houseflies, mosquitoes and other insects which cause various kinds of diseases. Now we will discuss about the most important national and international body which is concerned with the people's health, that is Red Cross Society. It was established in 1864. Its emblem is Red Cross, which is painted on a white background. Red Cross Day is celebrated on 8th May every year. People of Red Cross Society, they can go to battlefields and take care of wounded soldiers, whether they belong to our country or to other country. The major activities of Red Cross Society are as follows. Number 1, they extend relief and help to the victims of any calamity. Either they are of flood, fire, famine, earthquakes, etc. Secondly, they supply blood to the needy victims of war and other calamities. Then they extend all the possible first aid in case of any accident. They educate the people about the accident preventions, arrange ambulance services in all the emergencies, and look after all the maternal and child welfare centers in towns and villages. The Indian Red Cross Society has also been engaged in training midwives or nurses so that they can help the people when they are in need. Now we will learn about WHO, World Health Organization. It was established in 1948 and is a specialized agency of UNO, that is United Nations Organizations. WHO has 6 regional offices in the world, including one in Delhi. Each regional office works for its member countries and its headquarters are located at Geneva. Member states of WHO are bound by the international sanitary regulations to send in all the relevant informations about the internationally notifiable diseases. Member countries of UNO focused on the need for creating an international body to look after the health problems of people throughout the world. So this was particularly felt in the field of research on the causes and cures of diseases. So this was the main reason for the formulation of WHO. Now we will learn about the main activities of WHO. Its main activities includes to collect and supply the information about occurrence of disease of epidemic nature such as cholera, plague, typhoid, yellow fever. In this case, many people are died and suffer because of the same disease in many areas. Its second activity is to promote and support projects for research on diseases. They are doing research work on the diseases and they are promoting and supporting the projects. They are paying for them. To supply information on latest developments about the use of vaccines such as cancer research, nutritional discoveries, control of drug addiction, etc. They also suggest quarantine measures, that isolation of patient to prevent spread of diseases such as in case of COVID. To lay pharmaceutical standards that to lay the standards of the medicines, that this chemical should be used in the medicine up to which extent. They are laying the pharmaceutical standards for important drugs to ensure purity and size of dose. Then they organize campaigns for controlling of epidemic diseases, endemic diseases. For example, goiter. They are telling that the goiter is occurring due to iodine deficiency. So in those areas where iodine deficiency is there, they should take iodized salt, etc. so that that disease should be prevented.